Artificial intelligence is everywhere these days, and with the Optomed Aurora AI, it has finally found its way into handheld fundus photography for accurate, on-the-spot detection of diabetic retinopathy. We're here with Dr. Blake Cooper of Retina Associates, Kansas City, to talk about this groundbreaking development in retinal medicine and the transformative impact both specialists and primary care doctors can expect from the Optomed Aurora AI in the evolving landscape of diabetic retinopathy screening.
My name is Blake Cooper. I'm an ophthalmologist. I practice vitreoretinal surgery in a practice called Retina Associates in Kansas City, Missouri. I have a strong interest in treating patients who live with diabetes. The problem with people who live with diabetes is that there's a lot of treatment burden that they have to take in and process. And one of the things that I think oftentimes gets lost in communication is that they're at risk for losing vision. Only about 60% of patients actually get to an eye care professional in that year. And so you have 40% of the population, at least in the United States, that aren't having their eyes screened in a meaningful manner. You use the example of someone who might have limited mobility. They might not be able to be the easiest person to examine. If you have a camera that is relatively easy to use and portable, you can then bring that camera to a patient rather than trying to get them into a machine or a desktop platform. The Optomed Aurora AI is a very easy camera to use because it will give you high quality image. What you need whenever we're just trying to detect retinopathies, we need to be able to see the retinal vessels. We need to see microaneurysms, we need to see lipid exudate, we need to see things that an algorithm will look at and use to be able to then detect levels of retinopathy. And the nice thing about the Aurora AI is that through an undilated pupil, which is comfortable for patients not to have their eyes dilated, you're able to capture a high quality image. That image then is able to then be put into the algorithm, and the algorithm, when compared to traditional grading from a grading center, gave a sensitivity and specificity rate well over 90%. So we're able to detect those who have retinopathy as also those who don't. It's an important point. One of the things that is important when you're discussing treatment for a patient is for them to understand and be able to see their levels of retinopathy. And so I had a patient who was wheelchair bound, was unable to get into a camera, and I was able to use the Optomed Aurora AI to take a high quality image of their posterior pole of the retina and was able to show them where they had hemorrhage and have them understand why that needed to be treated. So Aurora AI is an easy, simple camera to introduce into your patient flow. So you want to be able to quickly take a reliable image within just a short period of time. Staff, physicians can be trained to take high quality images. So what this is going to do for my practice is that I'm going to see patients who have treatable disease. I'm going to be able to have a more meaningful conversation because they'll already have been told that they have diabetic retinopathy has been detected. And it's not the first time they're hearing it. Oftentimes patients shut down when they hear a diagnosis. They've had time to process, and we're going to move to a more meaningful discussion, which is how we're going to then treat the retinopathy. So it's going to help my practice flow. I think what will hopefully help in a primary care setting is if it's implemented on the workup, initial workup, when you're taking blood pressure or you're taking pulse rate, it's relatively easy to take a quick retinal examination, and then you can move forward to, we've detected retinopathy, or good news, we have not detected evidence of retinopathy. And this is why it's so important to continue with diabetic management to prevent visual loss. And if you're fearful of a patient who have more advanced disease, having detection with Aurora AI, or more importantly, not detecting with the Aurora AI, might make it more meaningful to be able to start that medication in a safe manner. You might also decide to have that patient come back and screen them again in 4 months after they've been on the medication to see if their retinopathy's progressed. If it hasn't, I think that's important. If it has, even more important, you can then get that patient on to an eye care professional.
Well, there you have it. The AI revolution is here, And with Optomed Aurora AI, screening for diabetic retinopathy has never been faster, more accessible, or more reliable. To find out more about integrating this device into your practice or clinic, get in touch with Optomed US.